The healthcare experiences of many women, especially women of color, are untold. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederley with AHA Communications. In her book, The Pain Gap: How Sexism and Racism in Healthcare Kill Women, author and journalist Anushay Hossain shares her own trauma of giving birth and explores the eye-opening experiences of many women who were unheard and subjected to systemic sexism and structural racism. In honor of 2022's International Women's Day and Women's History Month, Priya Bathija, Vice President of AHA Strategic Initiatives, chats with Anushay to discuss her inspiration and research behind the book and ways we can empower women to share their stories in order to revolutionize maternal health care.
Thank you, Tom. And to our listeners, before we begin, please note that this podcast includes discussion around racism, sexism, infant and maternal mortality. It may evoke strong and sensitive emotions. If these topics may be difficult for you, we encourage you to opt out of listening. We also encourage you to always care for your safety and well-being. Anushay, thank you so much for speaking with me today. You just wrote a book, The Pain Gap. Can you tell us a little bit more about your experiences that inspired the book?
Well, thank you so much for having me, Priya. I am so honored to be on your podcast. Initially, I wanted the book to be all about America's maternal health crisis. The reason I wrote this book was because I, grew up in Bangladesh in the 1980s, and America really played a huge role. The U.S. State Department, USAID, into not only introducing the concept of public health, but really slashing our maternal mortality rates. In the 80s, Bangladesh was one of the highest maternal mortality rates in the world, and now we're really considered a development star. So I was really in that world. I mean, I went to the American school with all of these kids whose dads were and moms were like working at the embassy doing these programs. And I actually never thought it was possible to die in childbirth in America. I knew it was happening all around me when I was growing up. And when I went to start writing this book, I thought that the story began with me, but it actually began with my childhood nanny. So I was just thinking about how this issue has just always been around me. And then when I didn't come to give birth here, when it was time for me to give birth, it was so crazy. I mean, I think back to it every single day because I was working in the field. Okay, I was working on this issue. I'm lobbying on Capitol Hill on global health legislation. I'm working on international family planning, but I had no idea about America's maternal health crisis. I had no idea about it. And then when I almost died in childbirth here in one of the best hospitals in the country, even while it was happening and all the commotion, I kept telling myself that I was not going to die in childbirth in America, even while it was happening. So initially, I wanted this book to be all about maternal health. But when I started writing it and when I was working, obviously, to find a publisher and working with my agent at that time, it was really interesting. It was December 2019, right before the pandemic came to the U.S. And I have family in like Bangladesh, and she was like, I don't know if I can sell this book. I don't know if people want to hear about another health crisis. And I was like, oh, COVID's not going to come to the States. So then it actually became a larger book about women's health because the pandemic in so many ways, as you know, is just showing us everything that doesn't work. I don't think anyone's ever been more focused on health and healthcare than we are now.
Absolutely. Well, in your book, and you do talk a lot about women's health as a whole and the different pieces that have impacted our health, right? So mental health, the challenges of COVID, and different things throughout the book. But consistently you say, if something is bad for women, it's worse for women of color and the worst for Black women. Can you explain what you mean by that and share some examples?
Yes, I can. That is a really great question. I think race is one of the most sensitive topics to talk about in America, but I feel like with the pandemic, it's just undeniable and we just can't ignore the role of race in everything, healthcare, legal system. I always come back to maternal health because, as you know, maternal mortality rates are not just, of course, they're an indicator of women, the number of women dying in childbirth, but it's also an indicator of how a country's healthcare system is functioning overall and the overall position of women in society, because women have been giving birth since the dawn of time, and it's not an enigma for us, like how to intervene and save women's lives in childbirth. I mean, when I say that nobody should be dying giving birth, that is true, and no one should be dying giving birth in America. So when we see that America's maternal mortality rates are increasing, we have the highest maternal mortality rates amongst developed nations. It's not because of a lack of knowledge or medical expertise or resources, but we see that the situation is bad for white women and for women of color, who are 2 to 3 times more likely to die than their white counterparts. But for Black women, it's 3 to 4 times. And we say 3 to 4 times more likely, but that number is 243% more likely to die in giving birth in America than their white counterparts. So you have to ask, what is going on? And initially, pre-pandemic, people had really, racist explanations, right? But now we have a study that came out that said that college-educated Black women who are college-educated or more educated and have a higher, education degree, bachelor's and higher, are 5 times more likely to die than a white woman with a high school degree. So we know it's not an issue of education. And what the pandemic has really shown us is that it's racism, not race. It's driving these disparities in healthcare.
Yeah, thank you for sharing all of those statistics. It really is startling to see what is happening across our country when it comes to maternal health. And you shared a little bit about your story, but in your book you say, after nearly dying in childbirth, I wanted to understand, why didn't I speak up? So can you share a little bit more about that, and what are some ways that women can advocate for themselves to be heard and treated respectfully?
I think about my own birth story every day, because as you can tell, I am someone who will speak up for myself. I speak up for my loved ones, and I advocate for women, and my entire career has been about telling women to speak up. And I mean, now I understand, because I think I'm still processing the trauma of what happened to me. Now I think I understand why I didn't speak up. But while I was talking to women, it kept coming up. I think we try to be perfect patients. I think we try to be a good patient, the perfect mom, the perfect student. And I really think that's what I was trying to do. Somebody told me that you're not responsible for your birth trauma. And I wish somebody had told me that earlier. I don't want the onus to be on women, but until we can kind of get to a cultural shift where we believe women, because right now the default is not to believe women. We don't believe women about their health. We don't believe women about their bodies, period. We don't believe women when they say they've been raped. We don't believe women when they say they've been sexually harassed. And we definitely don't believe women about their pain and their doctor stories. That being said, there's quite a few things that women can do. I list them in my book in towards the end of the book. One of the most important things I think to do is that we think about healthcare. We should actually approach healthcare as a team effort. And the most important member of that team is you. You are actually the expert. This was like mind-boggling to me. I'm like, wow, why didn't anyone ever tell me this, that I am the expert, right? I know what I've been feeling. So coming in with family history, coming in, keeping a paper trail, those things are really important, because the more information you can give to the doctor, the more he's going to be able to help you. This isn't an anti-healthcare, anti-medical world, medical system, or anti-doctor book. It's about just people, women. There's a pain gap, there's a knowledge gap, but there's also a credibility gap. So if we can just start by, instead of the default being not believing women, to believe women, I mean, I think a good portion of these issues could be solved. So what I recommend in my book is bringing also somebody with you, doing your research, researching the doctor, bringing as much family history as you can. And this is something else that's really interesting that nobody told me. If you don't feel safe with your provider, or if you don't feel like he's listening to you, he or she, you can change your doctor. I never knew that. Also, I feel like I was raised in, like, you never question the doctor. So this is also very interesting. It's not, the power dynamics are so off when you're in that doctor's office. I had my parents here last summer and I was able to get them such good care and solve all their issues because I knew where I was going. I was so organized. I had all their documents and their blood reports and whatnot with me, but we don't always do that for ourselves. So.
Absolutely. And thanks for sharing so much about your own personal experience. And you shared what women can be doing. And this is an American Hospital Association podcast. So most of our listeners are individuals who are working and leading our hospitals and health systems across the country. What do you think they can be doing, either as individuals or as hospitals as a whole, to improve women's health?
I feel like your audience is such an important audience for me, but also the people who I need to kind of speak with the most, because obviously such a large percentage of healthcare workers, frontline workers are women. And what are nurses seeing? What are doctors seeing? I think something so important is that the medical world can get very kind of removed because it's so clinical and so, I don't know, scientific, I guess. But people's experiences matter and choices matter. And really, I mean, it sounds like a Hallmark card, but listen to your patient and especially women about their pain. I don't want to say implicit bias, but this tendency to dismiss women as soon as they start complaining and speaking up is, and I feel like we're all guilty of it. I don't think it's only happening in the healthcare world and in hospitals. It's definitely happening in corporate America and in offices. It's happening in homes. So I think it's just really important to listen to your patients. And when women, but also anybody says that they're in pain, take that seriously.
Yeah, that's so important. Listening to patients, believing patients, and really working with them to develop a care plan that makes sense and gives them choices in, in the case of maternal health, how they want to deliver their baby, but in general, sort of how they want to reach outcomes that are important to them. So I think those are all really great takeaways for hospitals and health systems. And so we've talked about some really serious topics today, and you address them in your book as well. But it's not all doom and gloom, and you are very explicit in saying that in your book. What are some of the upcoming policies that are playing out right now that excite you or that you hope our country will move towards in the future?
One of the things that I really love about America is that it's a very active democratic process. And I feel like the pandemic is giving us a really big opportunity. You want to make cultural changes, you've got to start with policy and you've got to start with the laws. So I was so excited about the Black Momnibus bill, which has everything we need. It was a group of 9 bills and then it became a group of 12 bills. And every major provision, I think, was in the Build Back Better. I mean, we've never had more bills in the pipeline. And our Vice President, Kamala Harris, was personally involved with so many of them. It's a huge deal, and I'm so proud of it. And the people who worked on it, not only Congresswoman Lauren Underwood and her incredible leadership, but the organizations that have worked with it. It's a really putting women's experiences and families' experiences center because, I mean, we're living in a pandemic. We're all, at our most vulnerable. If we don't listen to each other and not like help each other out now, but listen to each other and believe each other. So I'm really excited about that because a lot of stuff that America needs is just practical, like really practical interventions, like extending Medicaid, increasing funding, obviously, we have maternity care deserts across the country. Obviously, there's bigger issues in certain populations. So much of this is solvable. When I started my research for this book, I started by talking to women, and one of the first things I always said to them was, I believe you. Because so many women don't share their stories, and they're right, because they know they're not going to be believed. So it's so important for people in your world. And you know what it's like, Priya, as a woman, especially as a woman of color, you feel so validated. I think COVID is showing us your health is really important. And without it, we really don't have anything else. Nothing else matters.
Absolutely. And, I share your optimism and hope for change from a policy perspective. And seeing that full Momnibus package was a really awesome thing from a maternal health and from the purpose of health for our whole society, right? So Anushay, thank you for being with us today and sharing your experiences and journey in advocating for better healthcare for all women. And to our listeners, thank you for joining in today.
Thank you so much. Thank you so much for inviting me and for reading my book, I feel like you saw me and really understood my words. So thank you so much for inviting me.